Hello, everyone. My name is Bruce Doran. I'm one of the staff scientists at Worksite Science North. Hi, Dale. How's it going? I can't hear you right now. I guess you must be muted. So I'm one of the co-presenters for this CPR webinar. Del Mislik will also be presenting with me. She's a retired Blue Coat from Science North. And once in a while, you're going to see our tech wizard, Amy Henson. So there's Amy. And if you have any questions, if you have any issues, Amy will be the one. And also, if you have any questions during the webinar, you will be typing them in, and then Amy will be kind of relaying them to us. All right. So before we begin, if you haven't done so already, you will need two rolls of toilet paper and a lid that actually makes a sound, and you will need that because we will be practicing this hands-only CPR at home, and you need those materials to do that. So before we begin, I just want to thank two organizations. I want to thank Northern City of Heroes. They are a non-for-profit organization that actually was started by two doctors here in Sudbury. And they started this organization to promote hands-only CPR to people throughout Northern Ontario and hopefully even throughout the world. So I want to thank them because they helped us really build this presentation to be able to share to you. And also I want to thank the federal government because the reason why we can offer this program for free is that we received a grant from the New Horizons for Seniors program through the federal government. So that's why you can follow us and do this webinar for free because of that federal program. So thank you very much. All right, so Dale and I will be presenting about hands-only CPR, just some housekeeping items before we begin. I'm going to change my screen right here. There we go. You will notice that on top of your screen where it says gallery view, I'm going to click right here. You will notice that if you click on that, you can change the way Dale and I will appear on the screen. All right, so that's one way of doing that. The other thing also you can do, I'm just going to change a couple of things right here, is playing around with my computer right here. Okay, if you look at the bottom where it says Q&A, if you have any questions during the webinar, this is where you would click and send those questions to Amy, who will then relay them to us. All right, so you can see us, you won't see yourselves, which is great because it's really us you want to see and the stuff on the screen. And also, if you have any questions, please don't hesitate to ask. All right. So like I mentioned before, if you have not done so, you will need a kind of jar lid. A jar lid that if you press on it, it makes a sound, all right? And you need two rolls of toilet paper, which I think everybody has one, right? With what's happening with the pandemic, everybody kind of rushed. So everybody should have at least these items at home, and we will use those to practice how to do hands-only CPR. Okay, so during this presentation, workshop, webinar, we're going to talk about a couple of things. First of all, I'm going to kind of really explain the difference between heart attack and cardiac arrest. A lot of times people get those two terms confused, and how you react to one compared to the other will be very, very different. Obviously, you don't do the same thing for a heart attack as compared to somebody who has a cardiac arrest. I'm going to use some information stats about cardiac arrest here in Sudbury and also throughout Canada. Also, I'm going to show you, and we'll practice you and I and Dale, how to do this cardiopulmonary resuscitation, this hands-only CPR, and really showcase how that's different than the traditional CPR that you may have learned previously. And then we're going to practice how to do that. I'm going to show you also how to use an AED, an automated external defibrillator. So there's one behind me right there. I'm going to show you how to use it. These are the defib machines that you might have seen in arenas, in libraries, and really just to showcase how easy it is to use and that anybody can use one. And I'm hoping to, during the presentation, to dispel some myths and misconceptions that people may have about doing CPR and using an AED. All right, so let's start. What's the difference between a cardiac arrest and a heart attack? So let's look at a heart attack. All right. So when you look at a heart, you will notice that the heart has these blood vessels. They're called coronary arteries. All right. And these blood vessels will provide the heart muscles with oxygen, with blood, in order to be able to function the way they're supposed to function. And for some reason, during a heart attack, there's a blockage. There's a blockage in these coronary arteries. And if that blockage is really bad, what happens is that no more blood and oxygen will reach the extremity of that coronary artery. And essentially, what that could lead to is the death of those heart muscles where they don't receive any oxygen or blood. So essentially, you have a decrease in efficiency of the heart's ability to pump blood. But keep in mind, heart is still pumping, okay? It's still pumping blood throughout your body, but it is not pumping as efficient, all right? So the heart has not stopped, but you don't get as efficient pumping action as you would normally do. So a person that has a heart attack, first of all, they're still conscious, okay? They will tell you they're in pain. For many of us, it will be some type of chest pain. For women, sometimes the symptoms will be a little bit different. Maybe a pain in the jaw, general indigestion, backache. So there's some differences between men and women. So there's usually some type of pain, usually in the chest area, in the body. The person is conscious. Okay, that's really, really important. It's telling you they're in pain. So first thing you need to do is obviously you call 911 and have the person sit down. And if the person has medication for the heart, you can help them take that medication. So they have a pain, usually in the chest area, they're conscious, you're calling 911 and you're asking them to sit down and just relax. Okay, when we look at a cardiac arrest, it's a little bit different. Essentially, with a cardiac arrest, your heart has stopped beating. And the reason for that is for some reason, the electrical system in your heart is not working properly. So your heart has a natural pacemaker within it that will send electrical signals to different parts of the heart that cause the heart to pump like it's supposed to regularly. And for some reason, it's not working well. It's either stopped or it's shooting these signals haphazardly, and then the heart's kind of spasming, and that's called a fibrillation. Okay, essentially, there's no more blood that is pumped to the organs of your body, especially the brain. It needs blood, lots and lots of blood all the time. So essentially, the heart has stopped. It's not working. No blood is being pumped to the rest of your body. So you could just imagine what happens to the person. The person is unconscious. All right. The person's unconscious. They stop breathing. And essentially, that person is dead. All right. They're not telling you they're in pain. They're not telling you, I got pain in my chest. They're not conscious. They are on the ground. So that's where it's really important. Okay. Again, you call 911, but then it's really important that we start those chest compressions, hands only CPR, which we're going to show you in a few minutes. And if you have access to an AED, to also use it. All right. So one person's alive as well. The other person is essentially dead. So if we look at the differences between the two, a heart attack, the person is conscious, they are in pain. You call 911 and you ask them to sit down, take it easy. Where somebody with a cardiac arrest, they're completely unconscious. They are not responding to you. They are not breathing. They are essentially dead. Again, you call 911 and you start those chest compressions. So I want you to remember when we look at a heart attack, it's a blockage in the artery of the heart. So it's a plumbing issue. Okay, it's a plumbing issue that the heart's not working as well, but it's still pumping. It's not pumping as well, but it's still pumping. The person's alive, is still conscious, you call 911. Whereas a cardiac arrest, it's an electrical issue. Okay, the heart has completely stopped. That person is essentially dead. You call 911, but that's where we need to do those chest compressions ASAP. All right. Okay, so that's the difference between the two. Now, some of you, some people in the past have asked me, well, what would happen if you start doing chest compressions to somebody that's had a heart attack? Let's say I kind of messed up and I'm thinking that person is a cardiac arrest, but I started doing chest compressions on somebody that's really had a heart attack. Well, let me tell you, it's painful. if you get chest compressions done. So the person will tell you to stop. So obviously, if they tell you to stop, you're not doing chest compressions on. All right. So that's a really good indication that they are not under cardiac arrest. If they're not responding by telling you to stop, you'll see some type of response in the body. You'll see them moving, groaning, or something like that. Again, then you know they are not under cardiac arrest. They've had a heart attack or some other issue. All right. So let's look at some stats right here. So there's an estimated 35,000 individuals that have had a cardiac arrest in Canada. And give you some perspective, those are more individuals that have had some type of cardiac arrest in Canada than the number of individuals that die from a car accident. So it's quite common, all right? The survival rate here in Sudbury is less than 5%, and it's pretty common throughout Canada. It's actually pretty low, around 5% or even lower. And one of the reasons for that is less than 50% of individuals that had a cardiac arrest get some form of help. We call that bystander CPR. Very few people, many people, I mean, hesitate helping an individual that's had cardiac arrest. And that doesn't help, because if that individual doesn't get those chest compressions, their chances of survival decreases dramatically. All right. Here's another stat. It takes 8 minutes for paramedics in Sudbury, when they get the call, to reach someone that's had a cardiac arrest. That's the average. Now, how does that compare to other municipalities throughout Canada? Some of the bigger municipalities, if we look at Toronto, Vancouver, it can be around 10 to 11 minutes, okay? So Sudbury is, pretty good average. Again, this is an average. But it still takes time. It takes quite a bit of time for help to arrive to you. Here's a very interesting graph. You will notice the red line shows the percentage of survival of individuals that had a cardiac arrest if they do not receive some type of chest compressions or CPR, compared to individuals that receive CPR. So essentially, when you're doing those chest compressions on an individual, you're increasing their chances, or the time in which they could survive, all right? So if we look, from the red line, after 8 minutes, the chances of that person surviving will be down to zero. They will not be reanimated, or it's very, very rare. Whereas if somebody is providing that individual with chest compressions, you're increasing their chances of survival. So that's why it's really important that we all learn how to do that, because you can actually save somebody's life by doing those chest compressions. 80% of cardiac arrests happen at home. So we know we have these, AEDs, the defibs, in arenas and in libraries and public areas, which is fantastic. But in fact, most of cardiac arrests happen at home. So that's why it's even more important that you learn and that family members learn how to do this, because it could potentially happen to somebody in your own home. And in the era of COVID right now, we're all staying at home. So the chances of one of us potentially having a cardiac arrest is even greater, because we are at home even more. So that's why it's even more important for us to know this life-saving skill. So knowing CPR does make a difference, all right? So if we look at Seattle and the country of Denmark, the survival rate is about 20%. So I said Sudbury is about 5%. Their survival rate is about 20%, 4 times as much. And the reason for that is that a large portion of their population, about 60 to 70% of those individuals that live in those communities, know how to do CPR. So knowing how to do CPR does correlate with an increased chance of survival if an individual has a cardiac arrest. So knowing CPR does make a difference. So what happens really when you have a cardiac arrest? So when you have a cardiac arrest, like I mentioned, the heart is not pumping. There is no blood going to the organs. And one of the organs that needs a fresh supply of blood and oxygen is the brain. And if the brain does not get a fresh supply of blood and oxygen, even after 3 minutes, you might actually have some permanent brain injury. So that's why it's really important to do those chest compressions, because essentially those chest compressions will help that person to survive. So what do these chest compressions do? What does cardiopulmonary resuscitation do? Your hands end up taking the function, the work of the heart, all right? By pressing on the chest, what you are doing is you're moving blood throughout the body and you're pumping blood, fresh blood to the brain so that the brain doesn't degrade, doesn't start to die. You're increasing that chance of survival of that individual by doing those chest compressions. So one thing I want everybody to remember, okay? Now, some of you are saying, but I'm not an expert at doing chest compression. I'm kind of afraid to do it, you know? One thing I want you to remember is somebody that's had a cardiac arrest, they are dead or they are dying, okay? You can only help. You cannot do anything worse than what they are. They're dead. You cannot make them deader. There's no such thing, all right? So learning these techniques, what you are doing is increasing their chances to be able to survive. And anybody can do this, all right? Whether you're 5 years old or 85 years old, you can actually do those chest compressions. You can do steps to save that person's life. So let's say we come across a situation, all right? So we got this individual on the ground. You look around, you're making sure that it's nothing dangerous. You're not seeing electrical wire that could zap you, or it's nothing dangerous, okay? So you come up to this individual and you try to wake them up, okay? You can rub the sternum, you can kind of pinch their clavicle, you kind of move them around, they're not responding. And then you can see whether or not they're breathing. You can put your hand next to their nose, or if it's a family member you feel comfortable with, maybe the cheek. They are not responding, they are not breathing. So at this point, you are assuming that this individual has had a cardiac arrest. So what do you need to do? So first of all, you need to call 911, all right? It's no use doing chest compressions if you don't have help coming, right? You need to call 911. So you call 911. If you have access to an AED, go get it, all right? But like I said, 80% of these cardiac arrests happen at home, so most of us don't have an AED. So the next step is you need to push hard and you need to push fast. You need to do those chest compressions to increase that person's chance of survival, to give them that time they need for help to arrive, to be able to really help them. Okay, so we're going to show you, Dale and I, hands-only CPR, okay? And hands-only CPR essentially is just doing chest compression. We're just pushing right on the chest to get that blood moving in the heart. Now, some of you have learned traditional CPR, where it's a combination of chest compressions and also giving air, ventilations. And you might say, well, why now are we just focusing on chest compression? And the reason for that is, there's a couple of reasons for that. One of the reasons is that for non-medical experts, such as you and I, medical experts have actually shown that doing chest compressions helps an individual a lot more than doing the two of them, okay? So for most people, chest compressions is a better way to help that individual that has had a cardiac arrest. Secondly, it's very simple. You just push, you just push, you just push, you push it. Whereas the traditional CPR, you have to push a certain number of times. You have to then give them ventilation. So you have to move the head, give them ventilation, readjust yourself, push, so on and so forth. So there are more stats. Sometimes it's a bit confusing, and especially in the heat of the time right where you're trying to help that person, you might forget your counts and things like that. So by just doing hands-only CPR, it simplifies the methodology. The last thing is that people have this ick factor, which I completely understand, right? If it's a stranger or someone you don't know and you really want to put your mouth on the mouth of that individual, that individual might have something, you don't want to grab it. Anyways, so that ick factor, which resulted with a greater hesitancy of individuals helping a person that's had a cardiac arrest. So by kind of simplifying it, saying, okay, people just need to do hands-only CPR, removing that ick factor, really what these medical experts are trying to tell us is that we're trying to remove barriers so that if an individual is on the ground and needs help, you will actually help them. So it's hopefully to try to decrease, a person's hesitancy to help an individual that may be on the ground. That being said, if you know how to do traditional CPR with ventilation and you are comfortable doing it, go ahead. Nobody's going to stop you from doing that. But you know what? don't forget to do those compressions, because those compressions are really, really important to get the blood flowing. All right, so Dale and I will show you how we do hands-only CPR. We have these mannequins on the floor. So Dale will set up on her floor. I'm going to set up on mine right here. I'm just going to change my camera angle. All right. So I have these, these mannequins, CPR mannequins we can try out. I'm just going to change my microphone so you can hear me a little bit better. There we go. All right. Are you all ready, Dale?
Just give me a second.
All right. Okay. So while Dale is getting ready, I'm just going to kind of present the scenario. So I have an individual that's on the ground, is not responding, and I check they are not responding. I'm rubbing the sternum, pinching them. You can actually kind of move them a little bit. They are limp. They're not responding. I'm not feeling any breath. So I'm assuming this person has had a cardiac arrest. Okay, this person, the heart is not functioning. So the first thing I'm going to do, I have my telephone here. So the first thing I'm going to do, boop, 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 I'm going to call for help. All right. So I call for help. Help is on the way. So now we're going to assume at this point, I don't have an AED. All right. I don't have an AED. I'm at home and I'm going to do chest compressions on that individual. So I'm going to get close to the body. All right. And what I'll need to do is I need to put my hands right in the middle of the chest. Now, some of you might say, well, how do I know it's right in the middle of the chest? All right. Best way to figure that out is if you put your thumbs underneath your armpits, okay, and right where your middle fingers would join, this is where you would actually put your hands. All right. In the case of an individual that's on the ground, you kind of do the reverse. You take your middle fingers, you put them underneath their armpits, right where the thumbs would join. That's where I would do my chest compressions, right in the middle of that chest. All right. So I know where I need to press. What I'm going to do, I'm going to take my dominant hand, put it right on the chest. I'm going to take my other hand and put it over my dominant hand. Now, you could interlace your fingers like this. I know Dale doesn't like that. She finds it a little hard with the fingers. You could put just one hand on top of the other. Doesn't matter. Whatever you do, just put one hand on top of the other. So your
Bruce,
yeah.
Bruce, can you do me a favor? Could you stop your presentation for a moment, and then you'll go full screen for everybody so they can really see you really well?
Oh, sorry about that.
Yeah, that'd be awesome. Thanks.
There we go.
Yay! Awesome. I hope that's better for everybody.
Sorry about that. Okay, so I'll show you again where to put your hands. So thumbs underneath your armpits, where your middle fingers would join, right there. Middle fingers underneath the armpit of the individual, where your thumbs would join. Sorry about that. Okay, so dominant hand, my other hand. I'm going to interlace my fingers. If you don't feel comfortable with that, just one on top of the other. Okay, so now it's really important that your arms stay straight, okay? You're not pushing with your arms. You're actually going to kind of bend at the level of the hip right here, okay? You know what? I'm going to take off my blue coat so you can see my body positioning a little bit better. There we go. So right on the chest, my arms are straight. I'm not pushing with my arms. Actually, I'm going to use my body weight to push up and down, and I'm going to bend at the level of my hips. And I'm slightly above the body of that individual, so I can really press down really well. Okay, so now are you ready?
I am.
So we need to push down about 2 inches or 5 centimeters. Okay, so Dale and I are going to show you. We're going to push down. And then we got to let this release. You need the chest cavity to come back up to its usual volume. Okay, it's really important because you want the blood to go back into the heart so you can push more blood. So we're going to push one more time. Okay, and then release. Okay, so you see I'm using my body weight down and up. Now, some of you who may not have as much body weight, if it's hard to push down, what you could do, you can cross your legs like this,
that will cause your body to project a little bit more forward so that it might be easier for you to press down and really get that depth that you need. All right. So you need to push down about 2 inches or 5 centimeters. Now you need to push fast. Okay. You need to compress at a rate of 100 to 120 times a minute. All right. That's pretty quick. Okay. It's about 2 compressions a minute. So what you can do, you can think of a song like Staying Alive. All right. You can kind of follow the beat of that song in your mind, in your head, to figure out how fast you need to compress. All right. So Dell, you ready?
I am.
Here we go. So we're going to start. 1, 2, 3, go. Staying alive, staying alive. Terrible singer. All right, we're going to stop. All right, so I'm going to change positions just so you see a different angle. All right. So again, the same thing. Figure out where I need to put my hands, one on top of the other. So not everybody knows Staying Alive, especially the younger generation. So you can actually use a different song. And so we do this with the kids, and we use the song Baby Shark. So you can follow the beat of Baby Shark. Okay, so if you know it, let's do it together. 1, 2, 3, go. Baby shark do 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 do, baby shark do 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 do, baby shark do 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 do, baby shark. Mama shark do 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 do, mama shark do 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 do, mama shark do 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 do, mama shark. All right, very good, very good. Now the other thing you can do is you can actually use your phone to help you figure out the beat. And you can actually download a metronome. So that's what I have right now on my phone. And you can play it at the beat that you need to do those compressions. Also, if you call, let's say the 911 dispatcher, and you tell them you're going to be doing hands-only CPR, you're going to be doing chest compression, you can ask them to give you the beat. So they can play a beat on your phone as you are doing those chest compressions. So we're going to go with beat. And Dale and I, are you good to do it for 30 seconds?
Okay.
Okay, here we go. Here we go. So one thing I want everybody to notice, Dale and I are not being gentle on the mannequin. It is hard, and you are pushing hard, and you're pushing very hard inside the body, and you're pushing fast, okay? You're not being delicate with that individual, so don't be afraid, okay? You need to really push hard to get that blood moving. Oh, we got a question, Amy?
Yeah, so we have a question. And so if we're performing this on a woman as an example, because the dummies that we're using today look really male, are we pushing right in between a woman's breasts?
Yeah, well, it all depends, right? It shouldn't be, let's just say it shouldn't be as difficult, because just naturally the breast will be slightly displaced. So you should have area there. Now, interesting point, Amy. They've actually shown, there's actually stats that have actually shown that people hesitate a little bit more doing chest compression on a woman compared to a man, okay? So please do not hesitate, all right? If that woman, survives that cardiac arrest, don't worry about it, okay? It is more important that you do those chest compressions, you press hard and you press fast. So that's a good point, yeah.
Yeah. And so if we're using our hands, so you're saying you're using our hands, are we using like the palm part, like this sort of part here? Are we using the whole flat hand? Like, what are we using?
You're trying to use the palm of your hand, but you know what? As you're doing it, and especially if you're doing this over several minutes, do your best, okay? Try to maintain your palm position, try to maintain your hand position as much as possible. The other trick with this is if you have other people around you, I'm slightly out of breath. You could just imagine if you have to do this for 8 minutes or 20 minutes until, help arrives, kind of switch to somebody else. Have somebody else do it for a minute or two, just so you can catch your breath and then you can continue on, right? We get lots of questions, people saying, how long do I do it? Do it as long as you can, right? Until help arrives. Now, if you're doing this, okay, and you're getting out of breath and you're about to pass out, stop, all right? It's no good, right? The paramedic doesn't want to deal with 2 patients, right? 1 patient is enough. So do your best as much as you can, all right? And if there's people around, kind of switch it up so that not one person is just doing those chest compressions.
Yeah. And so we can do chest compressions over clothing as well, right? We don't need to expose their bare chest if we're just doing chest compressions. We can do it over, a coat or sweater, whatever, as long as we're doing it deep enough. Is that right?
Yeah, if you can press deep enough.
Mm-hmm.
With most coats and sweaters, you should be okay. If somebody's wearing hockey equipment, it might be harder. You might have to remove,
yes,
that chest plate and things like that. And we're going to talk about it, but if you're using an AED, it needs to be exposed to bare skin. So you might have to remove the clothes in order to do that. But for most people, and especially at home, yeah, you can leave the clothes on and just push hard and push off.
push hard, push fast. And so if we're pushing hard, I mean, you're pushing really hard on that mannequin. Is there a risk that we could break, bones in the chest or anything?
Yeah, there's a very good chance that you might end up doing, damage to the ribs, and that's completely normal. In fact, if you're doing chest compressions well, you could potentially break some ribs, and that's okay. There's nothing wrong with that. In fact, from Northern State of Harris, Dr. McIsaac kind of told me, she said, you know what? She says, I can fix ribs, but I can't fix brains. So do your compressions. If that person survives, okay, well, the ribs will heal. So don't worry about it. Press hard and press often. So yeah, it could potentially happen. Yeah.
Okay, perfect. And then one last sort of question. So there's a couple of questions we're going to get to a little later in the presentation, because there's a question about how do we perform this on a child or a baby. And so we'll get to that a little bit later. Yeah. So hold tight on that one. We want to make sure that we get through this part first. And then the other thing is, though, does it matter if I kneel on the right side of the person's body, the left side? Does it make a difference?
No, as long as you're able to do those compressions, it does not matter. I've actually had one ER doctor, she's a little small. So she says she straddles, so she could put more of her weight down, right? Yeah. So whatever is easiest for you. I probably wouldn't recommend it for most people. It might be a little bit harder physically to do that. So either side, it's fine. And in fact, if you do it one side and you got the other person in front of you, waiting for you to do your compressions for, let's say, a minute, then you can move off and then that other person can start right away. So you can kind of tag team in that fashion.
Right. And so now one of the other questions we had is, like, you've got their patient right now, they're on the floor. So you've got a nice hard surface. What if somebody is on a bed and like that person just isn't, able to pull them off the bed onto the floor? What should that person do?
So first of all, you're calling 911, so you're getting help. If you're the only person, let's say you're the only person and you have a bigger individual in bed, you can't pull them off the floor, you can do compressions, but they won't be as effective, all right? So that's where, it's best if that person is on a hard surface, which would be the floor, to do those compressions. I've had people say, well, what if you put a book underneath? And the problem is the whole bed is squeaking, right? It just won't work as well. So if you could put them on a hard floor, that's fine. Get somebody to help you move them on a hard floor. But if worse comes to worse, there's nobody around and you're the only one, even doing partial compressions that may not be as deep, you know what? You're helping that individual. You're doing more than nothing, right? Do your best. That's really the message I want everybody to come across. Do your best to help that individual.
Absolutely. And again, it's sort of like, we had this question of like, what if we puncture, vital organs? Well, we've already said too, is that person's already dead, right? If you don't do anything right now, they're going to remain dead. And so that's a really, really, really important part of this. So absolutely.
Yeah, so it's really important to get that blood going, to be able to give them a chance. Well, you want the blood to go to the brain, give them a chance to be able to survive. Because if you're not doing anything, fine, you're not puncturing organs, but that person has no chance of survival. So do your best to help that individual. That's the important messaging I want people to do. So Dale, before we continue on, how do you feel doing those compressions?
It's, leaning over and having your weight over the middle is good, but I still feel it in my forearms. So, because you're really pushing hard, these mannequins are hard, and to get that 2 inches. So I would be hoping to be closer than 8 minutes away from help arriving.
Yeah, that's it. And then, like I said, I mean, we're not all bodybuilders. We're not like, athletes. We can't be expected to, do chest compressions for like 8 to 20 minutes. Do your best, okay? Do as much as you can until help arrives. And then once help arrives, hopefully they'll be able to reanimate that individual. So yeah, it's not easy. It's not easy on the arms. It's not easy on the back. You tend to lose your breath as you're pushing really hard. And frankly, if you're not losing your breath, if you're doing compressions, you're probably not doing it well enough, all right? You're probably not doing it fast enough or not doing deep enough, all right? And it's also important, I mentioned it also, but it's also important to let the chest expand, okay? If you don't allow the chest to expand, blood won't go into the heart like it's normally supposed to, okay? So it's really important that we do that. All right, very good. So I'm going to go back to my chair and we're going to continue our presentation. Dale, you can go back to the table. There we go.
If we're doing response time around here averages about 8 minutes, and we are pumping the residual oxygen in the blood around, how long does the oxygen last that's in the blood?
That's a good question. So give me a second. I'm just going to put this big. All right. That's a good question. And all right. So I've seen some studies done that, there's some residual oxygen in the blood that could be, I don't know, anywhere with 5 to 10 minutes. All right. So there is some residual oxygen in the blood, but it's hard for me to really give you an answer because it depends on the individual. If the individual is not as healthy, if the individual has lung issues, if the individual is a smoker, right? So it can depend from one individual to the other. The other thing also we need to keep in mind is as your brain is doing whatever it's doing, right? It's metabolizing, it's doing whatever it's doing, it's producing waste product, all right? And if that waste product isn't flushed out from the brain, that's what also kills the brain cells, the neurons. So by pushing and allowing blood to go, it may not have as much oxygen as somebody breathing normally, but you're hopefully flushing out all the junk, all the waste material from the brain so that that waste material isn't killing the brain, all right? So there's a kind of a double action. You're providing some oxygen, which is good, better than nothing, but you're also removing waste product. So Dale, I can't really answer a question, if there's a magical number and how much residual it is, but essentially experts say for most, again, you and I, non-medical experts, just concentrate on those chest compressions. And keep in mind that even those who do ventilations, if you're doing proper ventilation, it's like, how much air is actually getting into the lungs, right? It's not that much. So it's more important to do those chest compressions because they've actually shown that, for some individuals, again, non-medical professionals like us, we're doing the compressions, we're doing, 30 compressions to do 2 breaths. We're doing the compressions and finally the blood's starting to flow inside the body and then we stop. And then we do our two little breaths that frankly, not as helpful. And then you're then have to do another 30 seconds to get the blood going. So that what they're saying is more important to get the blood flowing than stopping to give a bit of air. Okay, so that's the idea behind it.
And when we're doing all these compressions, does that also affect the lungs at all a little? Like, is any oxygen coming into my lungs because I'm compressing and they're compressing and releasing?
There may be a little bit. Keep in mind that you always have some residual air into your lungs. So you have to push it out to be able to breathe it in. So the amount of that air coming out and how much of the fresh that's coming in, there's probably some, but not as much as somebody that's actually breathing. Okay. So it's not to say it doesn't help doing those chest compressions, getting some air in. And keep in mind that maybe one of the reasons why that individual isn't breathing, there may be a blockage, right? Somewhere in the trachea. So some people ask me, well, do you check inside the trachea to see if there's a blockage to try to remove it and so on and so forth? If you are comfortable doing that, go ahead. But if you don't know the circumstance and you're not really comfortable with kind of fishing stuff out of people's mouths and the trachea, just do the compression. Push hard and push often. Okay, that's really the rule of thumb that we want people to do. All right. Okay, so just a kind of an overview, okay, of hands-only CPR. So we assume that the person's unconscious. It's safe for you to approach them. They're unconscious. They're not breathing. You call 911. So you kneel next to the person. Put your hands right in the middle of the chest. Okay, arms are straight. Okay, and you're pushing with your hips. You're not pushing with your arms. You're going to get real tired real quick, and you can't really push as well deep with your arms compared to your body weight. About 2 inches into the chest, and a rate about 100 to 120 times a minute. Okay, and you continue until help arrives. I said within limits. If you're the only person and you think you're going to pass out, well, stop. If you can't do any more, stop. All right, but if there's other people around, go ahead. Some people say, well, what's the limit? How long can we do it? Do as much as you can. Okay, I can understand. You live at a cottage and you got one of your neighbors, that keels over and you're doing chest compressions. It's probably going to take hours before help really arrives. So do your best. Do as much as you can to help that individual until somebody comes to help you. All right, excellent. So just one little modification with what's happening with COVID-19. If you have an individual that you come across that had a cardiac arrest, again, call 911, use an AED. But then in order to not contaminate that individual or not contaminate yourself, the recommendation is put something over the face or the mouth of that individual. It could be a mask, it could be a towel, just something to prevent the viruses to be spread out from that individual, or you don't give it to that individual. So that's really the only other recommendation that they're giving for individuals doing hands-only CPR in this era of COVID. But like I said, most of the time it's probably going to happen at somebody's house. It's probably going to happen to a family member. So I don't think it's the top of mind about COVID. You're just going to help that person as much as you can. That's probably the rule of thumb. Okay, so Dale and I showed you how to do hands-only CPR. So now we're going to get you to try it out. You're going to need a lid, and you're going to need rolls of paper towels, okay? Not paper towels, toilet paper. So we're going to set up on the floor, Dale and I've got, and I think Dale also, we just got little, blankets or just something to put your knees on so you're not on a hard surface. If you feel you cannot do it on the floor, you can follow us and do it on a table, or you could do it on a chair. It's up to you, okay? Whatever is most comfortable for you. But I'd like everybody to try it out, what we need to do in order to save someone's life. Okay, so now I'm just gonna stop sharing my screen so that we can see everything together. I'm gonna just change my microphone. There we go. And Dell, if you want to put yourself in position. There we go. Like that. If you want to set yourselves up, people watching, you might want to bring your tablet or computer on the floor if you're set it up on the floor so you can see me and Dale. Kind of explain what we're going to be doing. All right. Just put yourself in your position so that you're going to be working in an area in front of you, and you have the screen or a computer or tablet in front of you so you can see what we're going to be doing. All right. Okay. So I got my towel here. So first thing you're going to do, you're going to take your lid, okay, and the open area of your lid, you're going to put it onto the floor, just like this. All right. If you have a hard not cement floor, tile floor, or wooden floor, this might move around a little bit. So if you want to put something underneath like a towel so it doesn't move, it's up to you. I'm just doing it on the carpet. It's easy.
And it's essentially what you want your lid to be positioned so that when you press on it, you can hear it click. That's the point of that. Okay, so now you're going to take one of your toilet paper rolls, okay, and you're going to set it up like this, okay? So you can see right through it like that. Then you're going to take your other roll and you position it on top. Now, they may roll over, so I just kind of squish just a little bit, one on top of the other, just like that. Okay, I'm going to keep my hands on it. So this contraption that we just built simulates really what, you know, the depth that you need to push down on the chest in order to get that blood flowing as you're doing those chest compressions, the hands only CPR. So you're going to put your dominant hand on top of the toilet paper roll, your other hand interlace if you can, okay, your arms straight, your body on top of it. And now what we're going to do, we're going to push down 2 inches, 5 centimeters, and you're going to know that you push down enough because you're going to hear a click, and then you allow the toilet paper rolls to expand afterwards. So we're going to push down, you hear the click, and then we're going to allow the toilet paper rolls to expand. Okay, now they won't expand to, you know, the way they were, but you should see the rolls in the middle opening up a little bit. Okay, we're going to go down one more time. And like that. Okay, we're going to do it one more time just to get you a feel how deep you need to press, and then up. So Dale, how does that compare when we talk about the amount of force you need to push down, this compared to mannequins that we were doing?
Well, this is a lot less force to get toilet paper to crush.
Yeah.
Assuming that the mannequin is realistic to humans.
Yeah, it's a bit more realistic to humans. So obviously the amount of force we're pushing down won't be the same as a human body, but at least it gives you a sense of how far down we need to push. Okay, we're going to push one more time. Here we go. 1, 2, 3. And then up. All right. So now you know how far down we need to push. The next step is that we're going to need to do compressions for 100 to 120 times a minute. Okay. So we're going to have to push really, really fast. Okay. So I'm going to try to sing. I say try because I'm not really a good singer. Staying alive. So we're going to try to go with the beat of staying alive. So one hand on top of the other, making sure that when you bring your hands up to allow the paper rolls to open, that you always have your hand on the top one. You're not jumping up and down. Okay. 1, 2, 3, go. Staying alive, staying alive. Oh, 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 staying alive. All right. We'll stop. So I'm just going to change camera angles so that you guys can see this a little bit better. A second here. There we go. This will be a bit easier to see. Okay. There we go. This time, instead of staying alive, I'm going to use my metronome. Okay. All right. My phone is acting up a little bit. Here we go. All right. So we're going to do it. We're going to follow the metronome, and we're going to do it for 15 seconds. Here we go. 1, 2, 3, go. Excellent. All right. So one thing I find doing this with toilet paper rolls, it's a little bit harder on your back because you don't have the weight of the mannequin to really help you to stay up. So it's a little bit harder that way, but at least it gives you a sense of how far you need to push and how fast you need to push. I'm just going to change the angle. So there we go.
I don't feel it in my back with the mannequin at all. And
yeah.
Forearms, but now I'm feeling the small of my back and a little bit in my forearms.
Yeah, it's just, I think we're trying to keep our balance, our core balance. Okay, so we're going to do another 15 seconds. 1, 2, 3, go. Excellent.
How
All
many,
right, good job.
Bruce?
Very good. Did a good job. All right, so I'm gonna get back to the table. Thank you very much. There we go. Change my
Just
microphone.
curious, Bruce, what did you have your metronome set to?
I had it at 110.
110, okay. And the number we're using is 100 and,
It's
100.
100 to 120.
Okay.
That's what we're asking, as much as possible.
Mhm.
There we go.
All right, so that was great. I think one of the good comments that we got was, this is tiring, and it is tiring. It's really, like, we have an exhibit at Science North that I've done with kids, and we race to see who can do the best CPR, and by the time we're finished, I am exhausted, and I know it's really tiring. And so one of the questions that we had was really about, what happens if, how long should I go for? What if I get really tired? What should I do? And maybe you could touch on that, Bruce.
Yeah, like I mentioned, do your best. If you get really tired, stop, because we don't want to end up with 2 patients that the poor paramedic needs to treat.
Mhm.
So do as much as you can. If you get really tired, just stop, right? You've done your best, and you've actually done something, and you've helped that person, right? Even if you've only done it for a minute or 2, which is fantastic. It's better than nothing else.
Mhm.
And the maybe the trick is if you can find somebody as you're doing it, or find somebody to help you as you're doing it, kind of relay that way, then you're increasing the chances that person's surviving. So yeah, don't put your health in jeopardy helping that individual. It's not good. It's not good, right? But do your best.
Do your best, yeah, right? You do as much as, because even if we perform CPR for 2 minutes, we've now given that brain blood for 2 minutes longer than it would have, and that could mean the difference between that person surviving and not. So that's one of the things that I think is really kind of important to
Yeah,
think
we can't forget that.
No, absolutely. So here's another question that we had is, what if this is a very good sort of thing. I'm like, so what if, you live alone, and you live alone in your home. And the question is there any kind of self-help solution that you could have? And there's 2 different things here, right? Between having a heart attack where you could still be conscious, versus having cardiac arrest where you basically immediately become unconscious. Is there anything that we can do if we live alone?
Well, first of all, call 911. You're not feeling well, you're calling 911, or if you have a medical alert system, please activate, right? So for a heart attack, if you haven't, fallen down, things like that, you'll feel it, and you should be able to at least activate your medical alert system to get some help. Whereas a cardiac arrest, it could be so sudden, unfortunately, there's not much you can do. So if you feel, any chest pains, you feel dizzy, you're about to fall, you think you're going to pass out, just call for help. Call for help, 911, and help will arrive. I get people that tell me, well, what if I call 911 and they tell me it's indigestion? Well, okay, it's indigestion. It's not the big deal, right? At least it's not something that was life-threatening at that point.
And the 911 dispatcher will not tell you that it's indigestion either. The 911 dispatcher will dispatch help, and that's their job, is to let professionals be able to answer those questions for you.
That's it. And frankly, if it's only indigestion, the medical professionals at the hospital will treat it. Then it's only indigestion. It's not a heart attack. So don't worry about, oh, you're inconveniencing people. No. When it's heart issues, don't take a chance. Call for help, because it's life or death. That's what it's all about. All right, so let's look at some of these what ifs. Do we have time to look at some of these what ifs?
We sure do, yeah. And I see all your questions, everybody. So don't worry, I will get to them, and we'll make sure that we get to them at the end, but I will get there, I promise.
All right. So let's say you're physically unable to perform hands-only CPR. So some of you are probably thinking of this. So what can I do? Well, you can always call 911 or activate your medical alert system, okay? And if you see somebody else that's around. If you know somebody else that's around, they can perform hands-only CPR. You just seen us do it, right? Dale and I just shown you. I just shown you all the steps on how to do it. You can coach that person to do it. Now you might think, well, I'm not a certified CPR instructor. It doesn't matter, okay? Anybody can show somebody else how to do hands-only CPR, just as I just shown you, and you'll be fine. There's definitely no issues. Anybody can help anybody else that needs help, all right? When it comes to, you know, hands-only CPR, and I'll show you with an AED. So try to find somebody else and coach them in doing those chest compressions. What if, we already talked about this, right? On the soft surface, so again, you call for help. If you can place that person on a hard surface, such as the floor, before you start doing compressions, that's the best thing. Just be careful that they don't bump their head, and then start performing that hands-only CPR on that individual, okay? Best to put them on the floor. What if, child or grandchild, probably a lot of grandparents are taking care of grandkids, right? And a lot of parents are at home with their kids. So what happens if a child has a cardiac arrest? Because it can actually happen. So again, you call for help, same thing, all right? Now for a child, I'd say, okay, these are just guidelines between the age of roughly 3, just over the toddler age, to roughly the age of 10. Instead of using your 2 hands, use 1 hand to do those chest compressions. You still push down 2 inches, 5 centimeters, and you still push at a rate of 100 to 120 times a minute, all right? I say that. If you happen to have a grandchild or child that's kind of really big, you know, for the age of 10, and you're trying to push down the chest, it's really not going down, then use your 2 hands, all right? So those are our guidelines. Now, for a toddler or really young child, what you're going to do, you're going to use your 2 fingers and you're going to push onto the chest about 4 centimeters, 1.5 inches. Again, 100 and 120 times a minute. So it's pretty much the same things you're doing. Just with a child, you're going to use 1 hand, so a bit less pressure. And with a young toddler or a child, then you'll just use your 2 fingers to press down on the chest, because the chests are a lot more pliable and you won't need as much pressure to push down. And again, you still push quite often, 100 and 120 times a minute. What if we talk about that? You end up breaking ribs. On the individual, you're doing hands-only CPR. Don't worry about it. Physicians can fix ribs, but they can't fix brains. So push hard, and push often, okay? Don't worry about, don't hesitate in thinking you're going to hurt that individual. You can only help that individual. Okay, so I want to finish off talking about automated external defibrillators, or AED. You've seen these around. There's many different models out there. And if we remember about a cardiac arrest, I said it's an electrical problem, right? There's the electrical system of the heart is not functioning properly, and you can have the heart kind of just spasming, and that's called ventricular fibrillation. And essentially what an AED will do, it will reboot the heart, okay? So what it will do, okay, so you got the heart here, and for some reason, there's an electrical issue. It's not pumping the way it's supposed to. So essentially what the AED will do, it will send an electrical signal through the heart, essentially stopping the heart completely. And then a natural pacemaker of the heart will then reboot the heart to make it pump like it's supposed to naturally. So as much as those chest compressions are really, really helpful in increasing that person's chances of survival, the chances of reanimating a person with just chest compressions is really, really low. You need an AED to be able to do that. All right, so I'm going to show you how to use an AED. I've actually got a trainer right here. So sit back and I'm going to show you. I'm going to stop sharing so you can see my screen a lot better. There we go. Again, change the angle. I'm going to change my microphone. Just mute it. All right. There we go. Okay, so there we go. I have an individual. I'm just going to back up a little bit. Individual, again on the ground. I've assessed the situation. They're not waking up. They're not breathing. And I call 911. Okay, that's the first step. Now, if you have access to an AED, okay,
and you're the only person, go get it. If another person can get it for you, let them get it. You start doing the compressions. When they come back, then use the AED, okay? So if you have access to an AED, it's really important to use it with those chest compressions. So an AED will be in some type of case, all right? So you remove it from the case, and all you have to do is usually there's a green button to activate the AED. In this case, if I pull on the lever here, it will also activate the AED. And essentially, I'm just going to follow the instructions the AED will tell you. Now, do not be afraid of it. It cannot hurt you. If you are alive, it won't give you a shock to you. I can put the pads on my face, on my head, it won't give me a shock. It will only give a shock under certain conditions, certain heart conditions. It will detect those conditions and give the shock. But with a healthy individual, a person that has normal heart rate, let's say you think this individual has had a cardiac arrest, but the heart is working normally, and you put on the pads, you won't be able to shock them. The AED won't allow that, okay? So it will detect that. So essentially, you turn on the AED and you follow the instructions. That's exactly what I'm going to do.
Begin by removing all clothing from the patient's chest. Cut clothing if needed.
So usually the case comes with a pair of scissors because you need the pads to be directly on the skin of that individual. So I
When
remove.
patient's chest is bare, remove protective cover and take out white adhesive pads.
So I'm removing the protective cover. I'm going to take out the pads.
Look carefully at the pictures on the white adhesive pads. Peel one pad from the yellow plastic liner.
So the picture is telling me to put the pad up here. So I'm going to remove it.
Look carefully at the pictures on the white adhesive pads. Place pad exactly as shown in the picture. Press firmly to patient's bare skin.
So I've done that. So now I'm going to put the other
When
pad.
the first pad is in place, look carefully at the picture on the second pad. Peel the second pad from the yellow. No one should touch the patient. Analyzing.
So now it's analyzing to see whether or not it's a shockable rhythm, if it can actually
No
give it a
one
shock.
should touch the patient. Shock advised. Stay clear of patient. Press the flashing orange button now.
So I'm going to press the orange button.
Shock delivered.
The shock's delivered.
Be sure emergency medical services have been called.
So it reminds
It's
me,
safe to touch the patient.
I can touch.
Begin CPR. For help with CPR, press the flashing blue button.
So I press the
Place the
button.
heel of one hand in the center of the chest, between the nipples. Place your other hand on top of the first. Push the chest down firmly 2 inches. Keep time with the beat.
So essentially what the AED is a kind of coach. You just follow what the AED is telling you to do. You really don't have to think of the steps because it's telling you exactly what you need to do. So I'm following metronome.
Pinch nose, tilt head, and give 2 full breaths.
So this model
Breathe.
is the model that tells you to breathe. If you do not want to give breaths, like I don't want to, I just keep pressing. I don't necessarily need to do that. If you're comfortable giving breaths, go ahead, give the breaths. But I'm just going to keep pushing.
Pinch nose, tilt head, and give 2 full breaths. Breathe.
You're going to keep pushing.
Breathe. Continue with compressions.
So for those who are very, comfortable doing breaths, you don't even have to think the number of compressions, the number of breaths. It actually tells you. So it's a great way. It's a great coach to keep you on pace, to tell you exactly what you need to do.
Pinch nose, tilt head, and give 2 full breaths. Breathe. Breathe. Continue with compressions. pinch nose, tilt head.
So this model tells you to do this for about 2 minutes
Breathe,
before it reanalyzes the heart.
breathe. Continue with compressions. Stop CPR. Press pads firm. No one should touch the patient. Analyzing. No one should touch the patient. Shock advised. Stay clear of patient.
So now
Press the
it's
flashing
telling me to
orange
give a
button.
shock.
Shock delivered.
So I'm going to stop it for now. So essentially, you just follow what the AED tells you, all right? There's different models of AED. Some of them have a screen that will show you the steps, so on and so forth. But really, it's there to help you, to coach you, to tell you when to do those compressions, when to deliver a shock. There may be circumstances where it says don't deliver a shock, okay? So it is a great coach to let you know the steps you need to follow in order to save that person's life. Now, some people are a little afraid of it because of the shock factor, right? What happens if I put I got my knee on that person or my hand on that person as it's analyzing? Well, a couple of things is that your hand is releasing, and your body's releasing electrical signals, which can actually confuse the AED. If that happens, probably AED won't even tell you to give a shock. If you happen to be touching the body, probably your knee, as somebody's delivering a shot, you'll probably feel some type of tingling sensation on your knee, all right? You're not going to be blown back and falling on the ground. That's not the case. So just be careful not to touch when you're the person about to give the shock, but otherwise, it is a very safe piece of equipment in order to save a person's life, okay? So don't hesitate to use it. And you know what? It's a great coach. It tells you exactly the steps you need to follow. So now that you know how to do chest compressions with this, you're increasing that person's chance of survival if they had a cardiac arrest, okay? So don't hesitate. Please use it if you have access to it. All right, so I'm going to get back to the screen. So, Amy, do we have any questions?
Yeah, we do. I'm just filtering through them all, making sure that I get to all the most common questions. I've responded to a whole bunch via text, so hopefully you can receive those responses. But Bruce, maybe I think the most important thing, because I know many of us around the table have kids, grandkids, things like that. Could you go through with us exactly how you perform CPR on?
Yeah, let's do it again. I'll just show you the
just one more time, yeah, just to make sure that we've got, because I think that's just really important to us.
Yeah. So obviously, like any other individual, you're calling for help. That's the first thing. When it is a child between the age of roughly 3 to 10, you're using one hand. Instead of the two hands, just one hand, and you're pushing up and down, okay? When it's a baby up to the age of a toddler, then instead of using your hand, you're just going to use your two fingers. And you're going to, again, in the middle of the chest, and you're just going to press up and down, okay? You're going to press not as deep, 1.5 inches, 4 centimeters, but you're still pressing the same rate. So staying alive, staying alive, staying alive. And the rule of thumb also, if you have a child that's a little bit larger or tall child, whatever, and you can't push down, that 2 inches with one hand, well, then use your two hands. That's the way it is. So it's pretty much the same process. It's just the amount of the force at which you're pushing will be a bit less with smaller individuals. That's really all it is.
So there's some questions now too. A lot of people are asking questions around legalities of performing CPR. So can I get sued if I perform CPR? If there's a patient, then and maybe there's a family member nearby who's saying no, don't perform. Like, what should we do in those circumstances? Yeah, and what are the sort of legal ramifications?
Good. Those are good questions. Mm-hmm. Here in Canada, we're protected by the Good Samaritan law, which means that if you're helping an individual using hands-only CPR, traditional CPR, with or without an AED to help that individual, you will not be sued. The way it works in Canada, if you come across an individual that is unconscious, the way the law works is that they have given their consent for you to help them. Okay. Now, that being said, if you come across an individual and there's family members that tell you not to do hands-only CPR, well, obviously you're going to listen to what the family members are saying. But if you're coming across an individual, it's a family member, somebody you don't know, and there's nobody around, by law, they've given their consent to help. So if you help them, if they survive, they will not come and pursue you. The family won't sue you. They can't. The Good Samaritan law protects you. Now you might say, well, we're doing this course online here. Okay, I'm not getting a certificate, an official certificate. And I'll tell you, ladies and gentlemen, I'm not an official CPR instructor. Okay, I'm a staff scientist and I'm just sharing this information. And okay, I didn't get the certificate. Bruce gave me all this information. Am I covered by law with this? Yes. Anybody can do these techniques I just shown you and use an AED, even though you have not taken an official certified CPR or AED course, right? Now, that being said, probably a good idea to take a certified, CPR and AED course, because they'll let you play around, for trainers and mannequins. They'll give you scenarios so you can practice even better. But don't let that stop you. You don't need that certificate. You don't need to take a official course in order to help somebody. All right. So don't feel as if I cannot help somebody because I didn't take, St. John's Ambulance or lifesaver courses, whatever companies are there. No, you can actually say that you can actually use an AED. There's no problem with that, because you are trying to save that person. And because you're trying to save that person, you are protected by Good Samaritan laws. So don't hesitate, help.
Mm-hmm. Absolutely. So, and there's some questions about AEDs, because I think AEDs kind of this new tool that, especially when I first started learning CPR, it certainly didn't exist, and it didn't exist in many places. And you can find them in all kinds of places, right? You can find them at community centers. I know we have 2 at Science North, right? It's always safe to come to Science North. But right, we there's community centers, but even local communities, because I know we have a lot of rural people who are joining us who where an ambulance and paramedics may not arrive for 15 to 20 minutes, right? And so many smaller communities are getting their own AEDs, or even some people are choosing to have AEDs at home, and that is also an option, is it not?
Yeah, it's an option. The AED that I have, which is a base model, it's about $1,500 to $2,000. So you could just imagine, let's say you're part of a cottagers association, each giving, a bit of money to buy an AED that goes in a central, cottage or location that potentially could save somebody's life, because it might take 15, 20 minutes or 3 hours, right, for help to arrive. It's a life-saving instrument. So yeah, you can buy them. You just Google. There's many different sites, different places that sell AEDs. The only thing you have to do every once in a while, there's a schedule where you have to change the battery pack, obviously, and the packs. So there's a cost every 3, 4, 5 years, depending on the model, that you have to buy these things. But once you have it, it's there and can potentially save somebody's life. So again, don't be afraid. Use it. If you see it, use it, because that can actually help reactivate a heart and save someone's life.
Yeah. So the AED itself as a unit is reusable. You just have to recharge the batteries, especially if you use it, like actually physically use it, you will need to do that. Yeah. The pads, however, are one-time use only. So you will need to replace the pads, and you need to replace them. They expire just like a medication. So you need to have those replaced as well, like on the regular, and they're not terribly expensive. I don't know how much they cost.
I think a pair of pads with the battery, I think every 4 to 5 years, I have to check at Science North. It's like $100, $150.
Yeah.
That's it. For the price of a life. So if you happen to save somebody's life, don't worry. That costs
Absolutely.
Bruce?
Absolutely.
Yep.
So with the AEDs, if the patient, we have to put it on the skin, and if we can't or remove or open the clothing, can we just reach under and place pads?
If you can, usually
people have nipple rings or belly button rings or metal rings or belts. Does that mess up the shock?
So first of all, the pads are here, right? So electricity will go through this, okay? Electricity will go through the body. So metals on the surface it could potentially go there, but don't worry about that. I've had people say, well, you know, I'm kind of leery removing bras, right, of an individual, you know, that type of thing. And I've had instructors say, just put it underneath the bra. If you really make sure it's under the skin. And if there's an underwire, worst comes to worst, the person might get a little burn, right, the underwire, but that person survives. They'll be more than happy about it. So don't worry about, make sure it's onto the skin. Now, that being said, if the person was in the water or completely wet, that will not work, okay? Because then the electrical shock, instead of going through the body, will go on the surface of the body, right where the water is. So it may not work as well. So you might have to towel down that person, make sure they're dried off before you can actually use an AED in those circumstances. So if you can't remove the clothing, if you put it at least onto the skin, you're increasing their chances of getting that shock to go through the heart. But a lot of these AEDs have these massive scissors. They cut through a whole bunch of things. I've seen people cut through like hockey gear. It goes right through. So you know what? You got a pair of scissors, go for it. A lot of times, you know, if it's at home, you got somebody with a t-shirt, if worse comes to worse, rip off the t-shirt, put on the AEDs, do your best, but it has to touch the skin. If it doesn't touch the skin, it's not going to be effective.
Dr. McIsaac just left me a note in our chat together, and she said, whatever you do, don't place the pads over top of like a bra or a piece of metal. Like so if you've got like a little clip or something here, like you wouldn't want to put the pad right on top. You want to slide it underneath, and that is a really important thing. So just make sure it's got direct contact with the skin the whole time, and that's the biggest.
And some people, like the pad will tell you put one here and one there. Some people, well, what happens if I put it here and here or there? Do your best, okay? But essentially, you want the pads to be between on either side of the heart. That's the idea, so that it goes there, right? Now, some people have had an AED for little ones. For little ones, there are special pads for that, and then the pads go in the front and in the back. But they will be indicated as for children, and it will indicate where to put the pads. So there are some circumstances for the little ones that may have special pads. But the chances, and not saying it doesn't happen, but the chances for little ones getting cardiac arrest are a bit less than adults.
And if somebody's got a lot of chest hair, Mark just asked me this question, and I understand it completely, is that you're just making sure that you get as much full contact. You're going to press really hard down on it and kind of squish it, like to make sure that it's got as much full contact with the skin as possible, because yes, we all know that can happen as well. So just and I think, Bruce, I always say, I think a lot of the answers to some of these questions today it's really about do your best, right? We're arming you with a whole bunch of great information and a whole bunch of tools. And in any circumstance, as long as you've got something in your tool belt, you've got something that can start, right? And you do your absolute best, because within cardiac arrest, Bruce said it at the very beginning, the patient is essentially dead already.
Yep.
And anything that you do is going to not harm them, but only hurt them, or not hurt them, but only make them better and help them. So that is a really, really important message that we want to get across.
And the technique we showed you with the paper towel and the jar lid, you've seen it. Mm-hmm. You can teach anybody that. Yeah. Anybody can learn that. And my suggestion to all of you, practice that several times a year, 3 to 4 times a year. If you can even practice once a month, it's even better, because it's really getting your body and your mind ready if a situation were to happen. How do I position my body? What are the steps I need to follow? I have to call 911. I have to check this, check that, so on and so forth. So practicing that on a regular basis, even though you may not have the same force to press down and things like that, it just gets your mind and body ready so that if a situation were to happen, you're better equipped to help that individual. That's the thing. And even if your chest compressions are, instead of 2 inches, they're 1 3/4 inches. And instead of doing 120 compressions, you're doing 90 compressions, because that's only how fast you're doing. You know what? You're doing a great job. It's better than nothing. All right. You're doing the best that you can to help that individual. And we're hoping, and that's where the Northern City Heroes group wants to teach as many people as possible to increase that survival rate from, less than 5% to let's get it up. Let's try to aim for 20%. all right? And the fact is, this can happen in your home. So it is a life-saving tool that everybody should know. Just like people living in Sudbury with 300 lakes and should know how to swim, this life-saving tool is something that everybody should know in order to save somebody else's life, especially when it's a family member and a loved one.
Carol, who's participating today, just left me a message saying we could practice it for exercise. I think that's brilliant. I love it. That's like the most brilliant thing. I think that's it's great. We have one more question. I think that's come up a few times because, of course, you know, there's quite a few of us that might have a pacemaker installed. What do we do if you know, with both CPR and using an AED if somebody has a pacemaker?
Okay, so if that individual that has a cardiac arrest, that has a pacemaker or whatever, chest compressions, go ahead, doesn't matter. You know what? Go ahead with the AED, right? The AED can only help. That's the thing. And that's only if you know the person has a pacemaker. If you don't know the person has a pacemaker, you're just doing the steps that you need to do whatever. Now, some people have told me, what if, you know, I'm doing chest compression AED and I have a pacemaker, and they may be afraid of AED. So like I said, it won't give a shock unless the heart has a shockable rhythm. So just make sure you're not touching that individual if you're giving the heart, because obviously you don't want to give yourself a zapped if you have a pacemaker. And again, do not put yourself in a situation where you're going to pass out. So then we end up with 2 patients. Do your best, okay? There's so many scenarios out there. What if? What we're showing you are just tools to help you help that individual that's had a cardiac arrest. Do not hesitate. Do those chest compressions, because that's most likely what we're going to end up doing. We don't all have an AED, and you're only helping that individual. You're only helping them to survive. So you know what? Help them. Do those compressions, do your best. You call for help, you're doing those compressions, you're doing more than, you know, was it 54% of individuals that weren't even doing anything, right? So if we get more people like bystanders doing those things, we're hopefully going to increase those rates of survival.
Dr. McIsaac just messaged me and she said the pads are actually placed far enough away from the pacemaker that you don't need to worry about it. So just put it on, use it, and use it as the instructions.
Perfect. Yeah. All right.
So
Any
just
other
one
questions?
more thing, so that everybody knows, because I had a lot of questions of this as well. I will be sending everybody who registered today. So if you received an email from me, I have your registration, and I will send you a recording of this today so that you can watch it after. You can absolutely share it to friends and family. This is the last one of our series that we've had, and so please share it. We will be posting it as well on the Science North YouTube channel, so please share it far and wide. Our main goal is just to make sure that everybody has this skill set, and we would love to have it shared with everybody, as many people as possible.
Okay, and I'm just going to finish by saying you have the tools to save somebody's life here and here, and use those. And you've just seen it, how to do it to save somebody's life. Don't hesitate, push hard and push often.
I feel a lot more confident that I'm going to jump in and not wait for somebody else to step in and take over.
Yeah. And my 8-year-old, she knows what to do.
I love it. I love it. All right. Well, thank you, everybody. I'm glad you joined us. I know from all corners, definitely of Ontario, but I know we had some from outside of Ontario throughout Canada as well. So thank you very much. And again, if you have any questions after, you all have my email, please go ahead and just ask, and I'll be there to answer them for you.
All right. Bye.